Hello, my name is Warren Tolley. I'm Deputy Chief Dental Officer for Welsh Government, and in this short presentation I'm going to explain what the proposal is for dentistry in Wales from the 1st of April 2022. But before that, I'd like to explain our strategic plan for dentistry. So in 2018, Welsh Government produced the document A Healthier Wales, Our Plan for Health and Social Care. Dentistry had to fit into this wider strategic document, and the previous Chief Dental Officer, Colette Bridgman, used this as an opportunity to replace and update the existing National Oral Health Plan. So the document was called The Oral and Dental Services Response, a Contribution to a Healthier Wales. Within that document, there are essentially four main themes. The patients and the public are at the heart of everything we do, a step up in prevention, ensuring dental services are fit for future generations, and developing dental teams and networks. And there is a proposal to concentrate on 5 priority areas to support the implementation. There are 5 priorities to achieve transformation in dentistry. Timely access to prevention-focused dental care. We know that the 2 main diseases in dentistry are largely preventable. We need to have a sustained and whole system change underpinned by contract reform. Expand the teams that are trained, supported and delivering to their scope of practice. And we need oral health intelligence and evidence driving improvement and planning. And we need to obviously ensure that there's improved population health and well-being. So why do we need to reform? Well, we need to make sure those with the greatest need also get access to dental services. We need to value prevention. We need to make sure we use the whole dental team. And we need to make sure working within the NHS is attractive to all team members to ensure that recruitment and retention is maintained, and ensure obviously that we get maximum value from any public funds. So are we using the learning from the contract reform practices prior to the pandemic? Yes, we're using ACORN, and we've used this as part of the COVID recovery package, fluoride application, recall intervals. So absolutely yes. So what will the new measures be on the 1st of April? Well, there'll be a continuation with the fluoride metric, but after listening to feedback from the profession, 0 to 3-year-olds will be excluded from that metric. ACORN data points will be mandatory, or forms will be rejected by the NHS BSA, and there'll be a minimum number of historic patients that will need to be seen. And there'll be a target for weekly new patients, and recall intervals will need to be followed. So practices will also have a responsibility to look after patients who previously had an NHS course of treatment. So will there be any financial penalty for underperformance? Yes. However, health boards will now have far more data to analyse. This will allow them to see more detail which practices have a disproportionate volume of higher needs patients, and so health boards will have more discretion to decide on financial sanctions within reason. So when you see the contract variation proposal, you will have a UDA target, and you may be wondering why. Well, the 2006 NHS GDS contract is still in place, and this is a variation to that contract, so it's not a new contract. On the 1st of April, you will be asked to sign this contract variation for a period of 12 months. The UDA target is essentially there to satisfy the legal issues of the NHS GDS contract. But the target is expected to be easily achieved so long as the other metrics are met. And I want to reassure you, Welsh Government are committed towards moving away from UDAs, and this is a significant step. So the anticipated benefits will be that practices will no longer need to worry about chasing UDAs. The remuneration system will be fairer because differing UDA values will no longer be as relevant. The barrier to seeing high needs patients will be removed, and there'll be stability for the practice and the team. However, we understand no contract is perfect. We will find unintended consequences, but this year will allow us to further learn and refine. Ultimately, there will be a need for a new contract, but the profession this time will help shape the future of dentistry in Wales. What if I do not wish to sign up for the contract variation? It's not compulsory, this will be an offer. Well, you'll have to revert back to the standard 2006 NHS GDS contract. However, you'll still be required to fill in all the data points on the FP17W, and this will include the 8 ACORN data points. Thank you.